I broke my neck in the Outer Banks and had surgery, and then ended up at McGee and was there for about the next 5 months or so doing rehab.
Families of catastrophic injury patients usually find this after their loved one has incurred the injury. They're in the rehab center and they've now met with their case manager.
We give them the information and then we urge them to pass it on to one of their friends or family members who are begging them for something to do for them.
For purposes of our services, we define catastrophic injury as those who have sustained a spinal cord injury, traumatic brain injury, or amputation.
A lot of folks want to get back to living a productive life, but sometimes there are obstacles in the way, and all those obstacles cost money.
After catastrophic injury, there are many expenses that families and patients could never anticipate that are not covered by health insurance.
I know that insurance covers physical therapy, occupational therapy, a lot of things while you are a patient in a hospital. But once you go home, you fall into a void where living life is very expensive, but insurance doesn't cover a lot of stuff.
When patients and families call us, they are desperate. They are overwhelmed and don't know where to turn for financial help.
When someone gets injured, you know, it's a natural reaction for family and friends to want to jump up and help. They don't always know how.
NTAF provides a way for communities to rally together and, with our guidance, fundraise for patients' uninsured medical expenses.
Some of them may actually want to organize a fundraiser but don't know where to begin. I can do that spaghetti dinner, but how do I get started?
Right before my injury, I had been ranked third in the nation in juniors in curling, and I traveled all over the country doing it. When I came out of the hospital in December, there was already a fundraiser through the local curling club set up in conjunction with NTAF.
An important role that NTAF plays for our patients and their families is taking the burden of organizing that fundraising and allocating those funds where they're not going to count against government assistance eligibility.
We get calls often from families where a well-meaning community member has started fundraising without using a nonprofit, without using NTAF, and have come to find that they have lost their benefits because of that.
You can only afford to make so much money before you lose, for me, it's almost $30,000 in medical coverage in a year.
If you're fundraising through an organization, it makes it very simple because they know it's going to a nonprofit, they know they're going to get the tax deductibility, and they know there's going to be fiscal accountability.
What families often don't realize is that as people come forward and offer to help right at the time of the injury, when they're most overwhelmed, is also often the best time to get some fundraising efforts going.
Assistance for catastrophic injury patients is needed most immediately to get the patient from the rehab into a home that most likely was not accessible before.
The proceeds that I've used from NTAF have gone to any number of out-of-pocket expenses, including an elevator in my house. The van has probably been the biggest thing that I've used the money for. It was a ballpark around $80,000, and $40,000 of which is the modification to it. And it's been a huge life changer rather than having to be driven around. The Curl-a-thon was an event put on for 3 years running now by the club members. It's 36 straight hours of curling, and over the last 3 years we've raised a total of around $80,000.
NTAF is a great vehicle to be able to help families and friends be able to do that. It's a safe, reliable organization that does great things to help folks and really can allow the family to get back to focusing on helping the person get better and not worrying about the money.
Recently, NTAF did an impact study that demonstrated emphatically that fundraising through our organization improved patients' quality of life in categories such as hope, health, stress, and getting out and about, being a financial burden. In all these categories and many more, people felt better about their lives after working with our organization.
My rugby chair that cost over $5,000, it was fundraising that really paid for that. Insurance wouldn't cover that. Community fundraising really gave me my life back.
Fundraising and assistance with NTAF has provided me the ability to have a life of independence, picking friends up, taking people to tailgate. It's been a phenomenal asset to me and really given me a life back that I didn't have before.